In this video, we're going to be going over type 1 diabetes, which follows from the previous video where I did a general overview of the different types of diabetes mellitus. Well, type 1 diabetes can also be called insulin-dependent diabetes mellitus, or IDDM. Another term for this is juvenile onset diabetes, because it usually occurs in individuals younger than 20 years of age. However, individuals above 20 years can also come down with type 1 diabetes. It's just less frequent. Type 1 diabetes is characterized by deficiency of insulin, and this is usually due to an autoimmune disorder where you have the immune system destroying the beta cells that produce insulin. You want to make sure you star that you know most type 1 diabetes is due to an autoimmune disorder. This is going to result in insulin dependence because you have to treat the person with insulin because they don't make enough insulin. If untreated, the symptoms are similar to a starving person, in that if they can't get glucose into the cells, they're going to break down more fats and more proteins to provide an energy source for metabolism, and this is going to result in a wasting away of the body tissue. Remember that insulin binds to its receptor on the cell membrane of the cells that utilize insulin, and that activates these signaling molecules to trigger these vesicles that contain the glucose transporter number 4 transporter, or GLUT4 transporter, to be put into the membrane so that glucose can move by facilitated diffusion from outside the cell to inside the cell, thereby lowering blood glucose levels. If you don't make enough insulin, then that glucose will be really high in the bloodstream because it can't get into the cells because the GLUT4 transporter is not put into the cell membrane. So the person will have really high blood glucose levels. They'll have hyperglycemia, but to the body, it thinks it's starving because it can't get the glucose into the cells. In addition to breaking down those fats and proteins, one of the products of fat metabolism that happens in the liver is that you produce ketone bodies. Now, these are normal in every one of us. We all produce a certain amount of ketone bodies because ketone bodies are used for an energy source by the neurons in the brain, by cardiac muscle cells. However, if you have increased fat metabolism, then you're going to make more ketone bodies. That's important to realize that when you metabolize fat, you're not just making ketone bodies from fat metabolism. You're making glycerol and fatty acids, and they're used as an energy source. But a certain small amount of that fat metabolism will produce ketone bodies. Well, if you have increased fat metabolism and you have an increase in ketone bodies, we call that ketosis. And if there's enough ketone bodies to lower the pH below normal, then this can cause ketoacidosis. Now, it's important to distinguish between these two. An increase in ketone bodies above normal is called ketosis. If you have enough ketone bodies to lower pH below normal, then that's called ketoacidosis. So everyone who is in ketoacidosis is also in ketosis. But not everyone in ketosis is in ketoacidosis. And if you need help with that, please let me know. You definitely want to make sure you star this, that ketone bodies include acetoacetic acid, beta-hydroxybutyric acid, and acetone. Now you can also refer to these as their conjugate bases. So acetoacetic acid is also called acetoacetate. Beta-hydroxybutyric acid is called beta-hydroxybutyrate, and then acetone is acetone. Well, severe ketoacidosis can lead to coma and death. A person in ketosis to ketoacidosis may have a sweet or fruity smelling breath due to the presence of acetone. Make sure you know that, which is volatile and leaves the blood in exhaled air. So in the lungs, you have these alveoli, which are just wrapped around with capillaries. And as the blood moves through the capillaries of the alveoli in the lungs, some of that acetone can go into the alveoli and then be exhaled through the bronchi, trachea, and out of the body. But it doesn't happen with the other ketone bodies, just acetone. A person with type 1 diabetes can certainly have high blood glucose levels or hyperglycemia, but they can also have really low blood glucose levels or hypoglycemia, which is below normal levels. And this can result to injecting too much insulin or inadequate food intake, or they can exercise excessively, or a combination of these can drop their blood glucose level. Acute complications such as hypoglycemia and ketoacidosis are more likely to occur in type 1 than type 2. It doesn't say a type 2 couldn't be in ketoacidosis, but it has to be really extreme for a type 2 diabetic to experience ketoacidosis. And there are a number of symptoms with hypoglycemia, including shaking or trembling, faster heart rate, extreme hunger, sweating, confusion, difficulty concentrating, dizziness. These are all indications that your blood sugar could be really, really low. Let's test your knowledge. Type 1 diabetes part 1. Pause the video and answer the following questions. Here are the answers. Type 1 diabetes part 2. Pause your video and answer the following questions. Here are the answers. Type 1 diabetes part 3. Pause your video and answer the following questions. Here are the answers. And this concludes the video, and let me know if you have any questions.